Hi everyone, Dr. Ryan here from Fundamental Health. Today I wanted to talk to you about the blood-brain barrier. So maybe you've heard of this before, maybe you haven't, but I'm going to be introducing what it is and how it may be affecting your health. First and foremost, I briefly want to talk about me as a board-certified chiropractor, how I can see problems with the blood-brain barrier, and then how I effectively go about helping that via chiropractic. So oftentimes blood-brain barrier, we're talking about whiplash injuries, concussive injuries, blows to the head, those kind of things. And through chiropractic adjustment, outside toxins, chemicals, things that you don't want entering the area of the brain, it keeps those things from getting into the brain and affecting the neurochemistry. So you want an intact blood-brain barrier that's going to keep nutrients out of that area. Now, there's two typical causes that can cause problems in that blood-brain barrier and allow these harmful things to leak into the brain and then cause neural problems, brain fog. They're starting to realize there's things like Alzheimer's, Parkinson's, all these other neurodegenerative diseases can be stemmed back to a leaky blood-brain barrier that's causing nutrients to seep over. So here's what I'm talking about, the two main causes. You have one, blows to the head, and we're talking about repetitive trauma, we're talking about athletes. So I played football for 15 years, a lot of football players, you're running around and it's contact sports, you're having these repetitive traumas, and sometimes they can be big enough, we're talking about like concussion type problems, and I'll get into that in a second. But these repetitive blows to the head or traumas can cause leaks in that barrier for things to seep into the brain that shouldn't be there. Also, the other typical cause is gut related, which I'll touch on this in a brief second too, but basically you have problems in the gut, they're going to cause problems elsewhere, including the brain. So let's dive right into the blows in the head. As a functional medicine provider and as a physician, I have a unique opportunity to work with special labs, advanced labs, and there's a lab that actually has a special test that tests for antibodies and antibodies in your system. And basically antibodies are there, or there's a spike or increase in antibodies. When your body's trying to fight something off or when there's a problem, it's releasing antibodies to help combat that problem. So what this test tests for is it tests for IgM, IgA, and IgG antibodies. Now, the IgM antibody is a good indicator that you had some kind of trauma or some kind of problem with the blood-brain barrier within the last week or so, so something more recent, okay? And then we can get after that more acutely and try to fix that more acutely. But IgA and IgG increases tell me that there's been more of a chronic or ongoing problem. So maybe it's diet related, or maybe you've had repetitive traumas like me 10, 15 years ago when you're in sports and it hasn't been resolved since. So you still have these leaks in this barrier here and things are seeping across that shouldn't be, and it's causing neural problems. So basically a spike in these antibodies tell me that something is wrong, that there's some kind of, more than likely there's some kind of leak or way that nutrients are getting past this barrier that they shouldn't be getting past, and that we need to address those to help decrease your symptoms. Okay, so those are blows to the head, and that's how I can address that through the antibodies. Now, a lot of different things can affect this barrier, and this is getting back to the gut is the main other reason that this can happen. So I want you to think of the gut in this way. I'm going to draw you a little picture here. You have this gut barrier that basically when you consume a nutrient, so you drink something, it's able to pass through your GI system and then excrete it from your body without crossing over into any other system, without going into your blood or anything else. It stays well within your intestinal walls, okay? So we'll say this is your intestines. Now, in between these cells here in the wall of the intestines, you have these tight junctions, or what we call them. And these are spaces, I think of them as like gatekeepers, and they pick and choose what's allowed to come in and into the intestine, what's allowed to leave the intestines. You want an intact, tight junction. You want it doing that job so that things that are supposed to stay in the intestines stay in the intestines, and things that shouldn't be in the intestines don't leak out into the intestines, okay? Now, over time, due to diet and other factors, you can actually disrupt these tight junctions, which will allow nutrients in the intestines to leak through those tight junctions out into the blood. So we'll say the blood's out here. So once these nutrients toxins, byproducts that you're breaking down from food and drink, you name it, things that you don't want leaving your gut are actually leaving your gut and entering your blood. Now it's being distributed throughout your whole body. So I'm sure you can see how that can be a problem, not just the brain, but other areas in your body. So chronic fatigue syndrome, fibromyalgia, and this is the cause for a lot of these different conditions, or the root cause, you can think of it that way. And this happens over time to such a low degree that you don't even realize it. And all of a sudden you have all these issues and you're like, where did this come from? Well, over time, these nutrients and toxins have leaked into your blood and been distributed throughout your body. So that can occur here as well. These toxins end up causing micro tears, and the same thing for blows to the head or traumas cause micro tears in this barrier that allow these nutrients to seep through into the brain, and then you're having the problem, central problem. So basically what I do, whether it's chiropractically or I'm using this lab to confirm that there's a problem, if I see a spike in those antibodies, I know that there's a problem chemically going on. More than likely we need to trace it back to the gut. So that's how this test is very helpful, and that's how this sets me apart than other practitioners in the areas. I can do more for an athlete, I can do more for somebody who's having neurological conditions, because not only do I treat just the physical part of it, but I can treat the chemical or the internal problem that may be causing those neurological problems by crossing that blood-brain barrier. Okay? Ways that we improve this is obviously going back and repairing the gut. Maybe it's repairing the physical impairments, whether it's muscle or joint related, that's causing the brain fog and the other neurological problems that you may be having. But it's also addressing the gut through testing, finding the problems, coming back. Simple things like getting rid of gluten and improving your diet can help repair the walls here in the intestines and keep things from leaking out too. So that's the goal of care once you find what that main problem is, and you need to use proper testing to make sure you find what that main problem is. So I'm sorry if anyone's commented or had anything to say at the moment. I have my camera turned so that I can't see if anyone's commenting or chiming in or have any questions for me. But if you do, please make sure to leave them within the next 30 seconds or so while I'm wrapping up. I promise I'll get back to them after this video is done going live and I've had a chance to turn it off. Like I said, I've just turned the camera, so I have no way of knowing if anyone's commenting. But if you do have any questions about anything I've shared or you'd like to learn more, please post a comment and I promise I'll get back to you. Also, if you found this information valuable, please like and share this video. I'd love to just get this information out to my community and the public. It's important that I'm teaching as much as I can about these things. With that being said, I want everyone to know, if you don't know already, I'm holding a Facebook Live, basically almost like a talk show where I'm just teaching every single week. Mondays at 6:30 p.m. I'll be going live and I'll be talking about different topics from nutrition to something along this lines to best exercises or stretches that you can do to help with back pain. You name it. I'm just making a set time for a class so that I can make sure you know when to show up and then provide you a ton of value as far as teaching you about your body. The other way that you can improve this barrier I wanted to touch on is sleep. Sleep has profound effects on your health and goes very far in terms of your health and well-being and energy levels and everything else. So what I've done is I've created a webinar. And this webinar will be, I'll be hosting it live on August 15th at 6:30 p.m. I'll make sure to comment at the end of this video too with the link to that webinar if anyone's interested. I'll be talking about sleep, ways to improve sleep, what sleep really is, how to get better sleep, you name it, because I know how important it is, and I have patients every day that come in and ask me, they're waking up with pain, or how do I sleep better, what pillow do you recommend having, those kinds of things. So I find it very valuable and very personal goal of mine to just teach you all about sleep. So recap, I'm hosting this webinar on August 15th. Be sure to follow the link that I'll post if you want to sign up for this. Even if you don't think you can make it, maybe you have something else going on that night, sign up for it. I'll have a replay link that we send to you via email so you can watch it whenever you want and learn on your own time. And then I'll be giving you a ton of different links to helpful information following from the webinar that I'll be teaching about, ways that you can go and explore more or maybe get more value from the webinars already. So I wanted to promote that webinar coming up on August 15th. Make sure to check it out, and hope you got some valuable information here, and I look forward to teaching you again very soon. Take care.